Newsday continues here on One News Now. I'm Charles Lejano. The Health Department has identified 34 hospitals which are set to receive the first shipments of Pfizer vaccines in the country. Let's get more details on this, as well as other updates from the Health Department from Greg Gregorio. He's joining us live from Mandaluyong. Greg, good afternoon. Where exactly are these hospitals located, and when are we expecting these shipments to arrive?
Charles, according to the Department of Health, these 34 hospitals are 32 of these 34 hospitals are located here in Metro Manila. It includes the Philippine General Hospital, the Lung Center of the Philippines, and the Jose N. Rodriguez Memorial Hospital. One hospital will be coming from one hospital is in Cebu, and the other one is in Davao. As to the question as to when will the shots arrive, we still don't have exact date as to when this 117,000 doses of Pfizer shots from the COVAX facility will arrive in the Philippines. Over the weekend, Vaccine SAR Secretary Carlito Galvez Jr. said we have already submitted the necessary documents for this shipment. It includes our readiness to receive these vaccines, but we are still waiting for more requirements that the COVAX facility would say we would have to meet. Charles?
Right, Greg, could you tell us more about this low-dead space syringe that the PGH, I understand, is in quite dire need of, and considering the lack of supply, is it still safe to say that we're all set for the inoculation of health workers?
Charles, first, this low-dead space syringe is designed to minimize the waste or wastage of doses of vaccines. Globally, experts found out that the per vial of the Pfizer shot includes 5 doses. However, if you are going to use a low-dead space syringe, you will be able to extract another dose or a sobrang dose na isa. So, according to the Philippine General Hospital's chief, Dr. Gap Legaspi, they are intending to use this same syringe for the inoculation of their personnel when the Pfizer shots arrive. However, according to Dr. Legaspi, they are having problem as to where to source the syringe because, as he has mentioned, there is a scarcity of supply of these type of syringe. As to the question, are we prepared? According to the Department of Health, there are syringe. They are going to provide syringe to the hospitals that will conduct the inoculation of our health workers and other personnel of these health facilities. Charles?
All right, Greg, let's talk about the new variant cases for a bit. I understand that the 19 new variant cases have been detected. Does this mean that there's already community transmission of the B117 variant?
Yes, Charles, you're right. There are 19 newly detected UK variant cases have been reported by the Department of Health over the weekend. 3 of them are from Region 11 or the Davao region, 2 from Calabarzon. Some are returning OFWs, while others are local cases, including 1 from Pasay City. And according to the Department of Health, even though that we have detected more UK variant cases, there's still no enough evidence as to predict or to say whether or not we already have the community transmission of this more contagious UK variant, because it turns out that samples from other regions are not enough. According to Undersecretary Vergere, we are having problems for the transportation of samples from Visayas and Mindanao, as well as especially BARM. According to Vergere, they have already coordinated with the Office of the Civil Defense to help in this matter. Charles?
All right, given that we have detected this 19 new cases, would there be any updates on travel restrictions? Maybe they're thinking about changing it. Do we have anything on this?
Charles, Vergere said there are still no talks about the reimposition of travel restrictions to any of the countries. Vergere highlighted that the UK variant has transmitted to more than 70 countries across the globe, while if we are talking about South Africa variant, it has been detected in at least or around 30 countries. So it is no longer ideal to close our borders for the longer time. According to Vergere, even though we do not have travel restrictions, we have safeguards in order to control or to prevent transmissions. She's pertaining to our testing and quarantine protocols that are existing as we speak. Charles?
Right, Greg, how are contact tracing efforts coming along insofar as these 90 new UK variant cases that we reported last Friday?
Charles, so far, 107 individuals have been identified as close contacts in Davao region. However, in other areas, there are still ongoing contact tracing and there are no available number yet as of now. Charles?
All right, thanks for that, Greg. We'll wait for that number when it does come around. Thanks. Greg Gregorio reporting live from Mandaluyong. Majority of Filipinos are still hesitant to receive COVID-19 vaccines. That's according to a survey done by the DILG. Undersecretary Ipimaco Dinsing III says only 3 out of 10 residents of Metro Manila are willing to get vaccinated against COVID-19. Meanwhile, outside the metro, only about 45% of residents expressed willingness to get inoculated. Dinsing says the government will never force people to subject themselves to vaccination. But he appeals to the public to keep an open mind as experts tout the safety and efficacy of vaccines. Vaccine czar Carlito Galvez Jr. defended the government amid allegations of snail-paced allegations between the government and vaccine manufacturers. In a TV interview, Galvez clarified that the limited global supply of COVID-19 vaccines is preventing vaccine companies from completing their deals with the government. He added that vaccine manufacturers also did not indicate any delivery dates for their committed doses. For now, the administration is focused on completing requirements for the COVAX facility that will supply more than 9 million doses of Pfizer and AstraZeneca vaccines in the country. The European Union is teaming up with the World Health Organization to ensure vaccine availability, especially among poor countries. Reuters reports.
The European Union and the World Health Organization will spend 40 million euros, just under $50 million, over the next 3 years to ensure better access to COVID-19 vaccines in poorer countries in the region. The WHO Regional Director for Europe, Hans Kluge, told a virtual news briefing on Thursday that Armenia, Azerbaijan, Belarus, Georgia, Moldova and Ukraine will benefit from the initiative, which focuses on readiness, information campaigns, supplies and health worker training.
At this point, the overwhelming majority of European countries remain vulnerable. Right now, it's a thin line between the hope of a vaccine and a false sense of security. Based on information from 29 out of the 37 countries currently vaccinating in the European region today, 7.8 million people have completed their immunization series. That is equivalent to only 1.5% of the population of those 29 countries.
The two-dose AstraZeneca COVID-19 vaccine developed with Oxford University had been clouded by doubts after a small study showed it was less effective at preventing mild or moderate disease with the fast-spreading South African variant of the virus. Kluge said while the variant was of particular concern, it was not yet widespread in the region but needs to be monitored carefully.
We'll be back with more stories after a quick break. Keep it here on One News. You're watching Bloomberg TV Philippines on One News Now. I'm Charles Lejano. Bitcoin is gaining steam after Tesla CEO Elon Musk's vote of confidence. But this did not appear to make the cryptocurrency any less volatile. Let's watch this.
GameStop's dizzying rallies and slumps have good company in Bitcoin. The cryptocurrency's rally got new life this week after Tesla CEO Elon Musk announced that the electric vehicle maker invested $1.5 billion in Bitcoin and signaled its intent to begin accepting it as a form of payment. But even Elon Musk couldn't save the cryptocurrency from its volatility.
Cryptocurrencies are a good example where you see the same type of price action, where it's not clear these are justified by any value argument and any fundamental arguments.
Bitcoin quadrupled in price in late 2020 after gaining some mainstream momentum. PayPal started allowing consumers to buy, sell, and hold cryptocurrencies in their PayPal wallets, and Fidelity launched its Bitcoin Fund. Millennials also jumped on the Bitcoin bandwagon by using stimulus checks to buy the cryptocurrency.
The concept of retail backing stock for it to go up and up and up. Bitcoin and Tesla are clear examples.
Bitcoin is also getting institutional interest. A Fidelity investment survey found that 36% of institutional respondents held crypto in their portfolios. More than 6 out of 10 expressed interest in Bitcoin and other cryptocurrencies, up from fewer than half in 2019.
I originally thought Bitcoin would end the year at 50 or 60,000. Things are happening so much faster than I had predicted. So now I think Bitcoin could end the year at $100,000.
Most of Wall Street is still sitting on the sidelines. JP Morgan is the farthest along in its Bitcoin acceptance. Last year, it agreed to take on Bitcoin exchanges Coinbase and Gemini Trust as banking clients.
I don't think the investor base is big enough and deep enough right now to support this kind of valuation.
There are regulatory hurdles that stand in the way of Bitcoin going mainstream. The U.S. Treasury Department has proposed requiring banks and other intermediaries to maintain records to verify customer identities for certain cryptocurrency transactions. Recording transactions would go against the very principle of Bitcoin, which promotes anonymity.
Those folks who have really dug in on this asset class know that using assets like Bitcoin for anything the least bit nefarious, illicit, etc., is probably the worst mechanism possible, since every single transaction leaves a digital breadcrumb.
One therapist in California is offering to release pandemic stress by smashing old furniture, tech devices, and others in her rage room. How's this helping people? Let's find out from this Bloomberg report.
Not only just COVID, but it's COVID related, but it's also stress related to job. I think COVID probably just sort of was the nail in the coffin for a lot of us. Having the destruction room here is also a very healthy outlet. I do not encourage it as something that we do on a regular basis, but I do find that when people come in, being able to break plates, being able to write out whatever's on their mind and letting it go, being able to just take out their frustration and their anger.
We're thankful to be able to come to a place like this and be able to break some stuff and release some tension without going to jail.
And those are the top stories of the hour. Join Sean Yao later at 2 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on the Signal Play app. Just register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Charles Lejano. We are One News.